The job description of a physiotherapist centers on improving patients' physical well-being through the diagnosis, treatment, and rehabilitation of injuries, illnesses, or disabilities. Physiotherapists use evidence-based techniques to restore movement, alleviate pain, and promote overall health. Their expertise lies in understanding the science of movement and applying therapeutic methods that help individuals regain functionality, independence, and quality of life. Physiotherapists work with a diverse range of patients, ranging from accident victims and surgical patients to elderly individuals and those suffering from chronic conditions. Whether the issue is muscular, neurological, orthopedic, or cardiovascular, a physiotherapist assesses each patient's condition and develops a customized treatment plan to achieve the best outcomes. In clinical, hospital, sports, or community settings, their goal is to enhance physical recovery, prevent further injury, and educate patients on managing their conditions independently. The responsibilities of a physiotherapist begin with comprehensive evaluations. This includes studying the patient's medical history, observing physical limitations, performing diagnostic tests, and discussing symptoms. Based on these assessments, physiotherapists identify the root causes of dysfunction and select appropriate therapy techniques such as exercise programs, manual therapy, electrotherapy, and stretching routines. They closely monitor progress, make necessary adjustments, and communicate regularly with both patients and medical teams to ensure continuity of care. In many cases, physiotherapists play a crucial role in long-term recovery. Patients recovering from surgery, strokes, or traumatic injuries often rely on months of therapy to regain full function. The physiotherapist not only provides the technical expertise but also offers motivation, emotional support, and encouragement throughout the process. In doing so, they help individuals regain confidence and improve their overall quality of life. Core responsibilities of a physiotherapist. At the heart of a physiotherapist's role is patient assessment. Each session typically begins with an evaluation of mobility, strength, flexibility, balance, and coordination. This data allows the therapist to create a tailored treatment plan that targets the patient's specific needs and goals. For instance, a patient with a spinal injury will require a vastly different approach compared to someone recovering from a sports-related knee injury. Physiotherapists employ a wide variety of treatment methods. These may include therapeutic exercises aimed at strengthening muscles, restoring range of motion, and improving endurance. Manual therapy, such as joint mobilization or soft tissue massage, is used to reduce pain and improve movement. In some cases, modalities like ultrasound, electrical stimulation, or heat-cold therapy are incorporated to support recovery. Education is another key component of the job. Physiotherapists instruct patients on how to perform exercises at home, maintain proper posture, and use assistive devices like crutches or braces effectively. By empowering patients with knowledge and tools, therapists encourage active participation in recovery and reduce dependency on external help. In rehabilitation settings, physiotherapists work alongside doctors, occupational therapists, nurses, and other healthcare professionals. This collaboration ensures that all aspects of a patient's treatment, whether physical, psychological, or medical, are addressed holistically. Documentation and record-keeping are also crucial, as therapists must maintain accurate notes on patient progress, therapy outcomes, and any modifications made to the treatment plan. At the midpoint of understanding this profession, it's essential to emphasize that the job description of a physiotherapist involves not only the treatment of injuries but also prevention, education, and long-term patient empowerment. Their role extends beyond the therapy room and into the patient's daily life, influencing habits, routines, and wellness choices. Skills required for physiotherapists. A successful physiotherapist must have in-depth knowledge of human anatomy, physiology, and biomechanics. This scientific foundation enables them to diagnose issues accurately and design effective rehabilitation strategies tailored to individual needs. Strong interpersonal skills are crucial in this profession. Physiotherapists work closely with people of varying ages, backgrounds, and physical abilities. They must be compassionate, patient, and able to communicate complex medical information in a way that's easy to understand. Empathy and encouragement are especially important for patients struggling with pain, frustration, or slow progress. Problem-solving abilities help physiotherapists adapt their approach when standard treatments don't yield expected results. They must remain flexible and willing to adjust techniques based on patient feedback or changes in physical condition. Innovation and creativity are often required to find the most suitable interventions for each case. Time management and organizational skills are important, especially when balancing a high number of appointments, administrative work, and interprofessional communication. Physiotherapists must allocate enough time for quality care while maintaining efficiency. Physical stamina is also essential. The job involves standing, bending, lifting, and guiding patients through exercises. Therapists must maintain their own health and energy levels to perform duties safely and effectively over long hours. A commitment to lifelong learning is another hallmark of a great physiotherapist. The healthcare field is constantly evolving with new research, technologies, and treatment methods. Attending workshops, earning certifications, and staying updated with clinical guidelines ensure therapists continue to offer the highest standard of care. Work environment and challenges. Physiotherapists work in varied environments, including hospitals, rehabilitation centers, private clinics, sports facilities, and nursing homes. Some also provide in-home services or work in schools and corporate wellness programs. The setting often determines the type of patients and conditions a physiotherapist encounters. In hospitals, therapists may assist post-operative patients with early mobility and respiratory exercises. In sports clinics, they might focus on performance enhancement and injury prevention. Each setting presents its own challenges and rewards. One common challenge in the profession is managing patient expectations. Some individuals anticipate immediate results, and it is the therapist's responsibility to explain the realistic timeline for recovery. Physiotherapists must strike a balance between motivating patients and being transparent about limitations or potential setbacks. Dealing with non-compliant patients is another challenge. If a patient fails to follow home exercises or attend scheduled appointments, their recovery may suffer. Physiotherapists must use persuasive and educational strategies to encourage adherence and accountability. Workload and emotional fatigue can also be demanding. Witnessing slow progress, chronic pain, or long-term disabilities may impact a therapist emotionally. Maintaining professional boundaries while offering genuine care requires resilience and emotional intelligence. Despite the challenges, many physiotherapists find their careers highly rewarding. Seeing patients regain movement, return to their daily routines, and improve their well-being brings immense satisfaction and purpose to the job. Qualifications and career opportunities. To become a licensed physiotherapist, individuals must typically complete a bachelor's or master's degree in physiotherapy from an accredited institution. In many countries, a clinical internship and passing a licensing examination are also required. Some professionals pursue specialization in areas like orthopedics, sports physiotherapy, neurology, pediatrics, or geriatrics. Career growth in this field is promising. Experienced physiotherapists can move into roles such as clinical supervisors, department heads, or consultants. Others transition into teaching, research, or policy making. With the rise of telehealth and wellness programs, there are also expanding opportunities in digital rehabilitation and preventive care. Some physiotherapists open their own private practices, offering flexibility and entrepreneurship opportunities. Others work with professional sports teams, military units, or international organizations. The field is continually growing in importance, especially with aging populations and increasing awareness of preventive healthcare. Conclusion. The job description of a physiotherapist is a blend of science, compassion, and strategic thinking. They play a vital role in helping individuals recover from injury, manage chronic conditions, and improve their physical performance. From assessment and hands-on treatment to patient education and emotional support, physiotherapists provide holistic care aimed at restoring function and enhancing lives. Their expertise spans multiple domains, and their ability to adapt, educate, and empower patients makes them indispensable members of the healthcare system. Though physically and emotionally demanding, the profession offers profound rewards through meaningful patient outcomes and personal fulfillment. Whether working in hospitals, clinics, sports arenas, or homes, physiotherapists remain at the forefront of physical healing, restoring not just bodies, but hope and confidence as well.